In this second video, we are going to discuss the anatomy of the chest wall with a particular focus on the musculature that is involved. The ILOs for this video are to be able to identify the musculature of the anterior chest, including the origins and the insertions, and to identify the actions of the intercostal muscles. If we think of these videos as a virtual dissection, then in this first illustration, we're demonstrating the removal of the skin overlying the chest as well as the removal of the pectoralis fascia. It should be noted that there is a thin muscle that blends with the deltoid and the pectoralis major fascia. This muscle is called the platysmus. It is said to originate from the pectoralis fascia and insert into the inferior border of the mandible and its adjacent muscles. However, for the purpose of this video and for the fact that the pectoralis fascia have been removed, it has not been included in the illustration. The muscle shown in red is pectoralis major, and this is a two-headed muscle. The clavicular head of this muscle originates from the anterior medial half of the clavicle. The larger sternocostal head originates from the anterior manubrium, the sternal body, the anterior aspects of the superior six costal cartilages, and the superior part of the aponeurosis of the external oblique. The external oblique muscle is said to originate from the external surface in the inferior borders of the 5th to the 12th ribs and inserts onto the anterior superior iliac spine, the anterior half of the iliac crest, the pubic crest and tubercle, and the linea alba. The linea alba is visible on this illustration, and it is a thick white fibrous band that extends from the xiphoid process of the sternum to the pubic symphysis. This next illustration demonstrates the removal of pectoralis major, the external obliques, and the associated fascia. This allows for the demonstration of the bony thorax, pectoralis minor, internal oblique, and the external intercostals. It should also be noted that internal oblique is being removed on one side to see rectus abdominis as well. I have also exposed the deltoid muscles in this illustration. In this pink colour, we can appreciate pectoralis minor. The origin of pectoralis minor is from the anterior ends of the 3rd to the 5th ribs, and the insertion is into the coracoid process of the scapula. And in this orange colour, we can see the external intercostal muscles. These muscles originate from the inferior borders of the 1st to the 11th ribs and insert onto the superior borders of the rib immediately below their origin. In green, we can see internal oblique, which originates from the thoracolumbar fascia, the iliac crest, and the inguinal ligament, and inserts onto the inferior margins of the 10th to the 12th ribs, the adjacent costal cartilages, the linea alba, and pectum pubis. Deep to the internal oblique muscle, on the left-hand side of this individual, we can see in red the rectus abdominis muscle. This illustration demonstrates the removal of pectoralis minor, the external intercostal muscles, internal oblique, and rectus abdominis. Deep to the external intercostal muscles lie the internal intercostal muscles, which can be appreciated in this illustration in this pink colour. The internal intercostal muscles have the same origin and insertion as the external intercostal muscles, this meaning that they originate from the inferior borders of the 1st to the 11th ribs, and they insert into the superior border on the rib below. Another set of intercostal muscles exists deep to the internal intercostals, and these are known as the innermost intercostals, which have been left out of this illustration, but can be found more lateral to where the internal intercostals are found. And as would be expected, the origins and insertions of these innermost intercostal muscles are the same as those of the internal and external. On this illustration, we can also appreciate transversus abdominis, as well as serratus anterior lateral to the ribs and the internal intercostal muscles as previously mentioned. It is important to understand the actions of the intercostal muscles in particular when it comes to respiration. So the external intercostal muscles act to elevate the rib cage, and the internal intercostals act to depress the ribs. and it remains unclear what the action of the innermost intercostals are.